Welcome to City Week, ladies and gentlemen. I am your host, Alton West. Today I'll have a guest on from West Georgia Health, and also I'll have on two guests from the City of LaGrange, the Business License Department. So make sure that you stay tuned for those interviews coming up in just a moment.
Why United Way? Because 99 cents of every dollar donated to United Way of West Georgia stays right here to help your neighbors. Yes, 99 cents. United Way makes every penny count. You can count on United Way, and United Way of West Georgia is counting on you. Please give today.
Welcome to City Week, ladies and gentlemen. I am your host, Alton West. And with the recent rash of flu symptoms and flu occurrences here in our community, I wanted to bring someone on from the West Georgia Health Department to kind of talk about that. And today my guest is none other than Bonnie Norwick, who is the Infection Control Manager. Bonnie, welcome to the show.
Thank you. Glad to be here.
Well, it's a pleasure to have you here and to sit down with you and talk a little bit about some of the things that we've been hearing and reading about in the paper. You know, people being infected with the flu viruses and getting sick. And unfortunately, we've had some unfortunate mishaps here in our community. Death resulted as a cause of that. Talk a little bit about, if you don't mind, Bonnie, for us, about your duties as the Infection Control Manager.
I watch infections as they come into the hospital. There are some infections we don't want to share with folks. In fact, we don't want to share anything.
Right.
So I monitor to make sure that the staff is doing what they need to do to protect our patients from one another. Sometimes we have to put them in isolation. We check and make sure that our staff don't have infections. No one is to come to work with a fever or a heavy cough. So that's pretty much my job. I watch the infections, make sure everybody does what they need to do to protect our patients.
Okay, and you brought up on that with a heavy cough, and sometimes we want to come on into work and, you know, have that little cough, and we may do the things, you know, kind of coughing to the sleeve and things of that nature.
Correct.
But if someone is coughing with a heavy cough or maybe even a slight cough, it's best for them to stay, you know, probably isolated. Is that fair to say?
If they're running a temperature with that cough, we don't want them to come in.
Okay, all right.
If they have any doubt, we send them to our employee health nurse and get checked out.
Okay, all right. You know, I guess because most of us kind of work in an office setting and things of that nature, and, you know, just a little common cough, I guess, is okay. But
Yeah, allergies is a big one.
Okay,
People,
all right.
yeah.
And this time of year, a lot of allergies start acting up. All right. Well, very good. And let's talk a little bit about the flu virus, Bonnie, because as we stated, we've seen in our community, read in the newspaper that, unfortunately, I think, you know, there's been some people that have caught the flu and have expired as a result of that. Talk a little bit about the types of flu that we're seeing here now.
We're seeing a lot of H1N1 this year. Last year we saw H3. H3 was a mild season, but this year we've seen the H1N1, and it seems to be hitting harder this time around for our community. We're seeing a lot of people with the flu. Some folks are getting it really, really hard, and we've had some people that passed away at our hospital, and we've sent some people to other hospitals for additional attention that also passed away.
Oh my goodness, okay. Let me ask you now, there at the hospital, and I know that there are certain testings that you all can do to try to determine which strand they may have, and then is that fair to say, or do you all have to send those tests or results someplace else?
The hospital does a screening test. That screening test is also available in doctors' offices. So if you're able to get to the doctor or the emergency room, they can do a test. But if we want to know if it's H1 or N1 or any of the other strains, we have to send it out. We don't have that instrumentation here to be real specific.
Oh, okay. All right. Very good. And H1N1, and that's the one I was riding home yesterday, and over the radio I heard him saying that the H1N1 was kind of the one that was more prevalent this year, and I think it has really taken a toll on a lot of people. And then the H3. Me, myself, I was telling you before we came on, back last year I caught a strand of the flu myself and had to be down for like 3 or 4 weeks. And when I was able to get to the doctor, they did tell me that I had, you know, the flu itself and had a fever. If someone is just not able, because like I said, when I got home and got into bed, that's all I wanted to do. If someone is having, we're going to talk about symptoms in a moment here, if someone is having some various symptoms like the flu and they can't make it to the doctor, what do you advise them to do?
Well, first call your doctor and see what they say. They may say just stay in bed, drink lots of fluids. But if you have difficulty in breathing, you come to an emergency situation, get yourself to the emergency room.
Okay.
You cannot get Tamiflu over the counter. You do have to have a prescription, and your doctor wants to see you before he prescribes that, because sometimes you could have something else going on, and they need to differentiate between your symptoms.
Okay, all right, very good. And Tamiflu, you mentioned Tamiflu, and I did get a prescription for the Tamiflu, and that is not something you can just go and get over the counter. You
Right,
do.
got to
Okay.
have that prescription.
Okay.
And it's best if you get it within the first 48 hours of your symptoms. They will still give it to you, but the best way to get rid of it quick is to get it soon.
Get it soon, okay. All right. And we're talking about symptoms, and I know they may occur differently in the individual. Talk a little bit about the symptoms that people might see.
Typically, you can be feeling fine in 1 hour, and the next you feel like you got hit by a Mack truck. You've got body aches. You may start with some congestion. You may have a fever. Sometimes we don't see fevers in older folks, but most people will have a fever.
Okay.
And you just want to go to bed and stay there.
Absolutely.
You got the flu.
I attest to that, that's for sure. Now, you're talking about fever, and I know the normal temperature, body temperature is 98, fairly, somewhere in that neighborhood? Okay, all right.
If you have a temperature greater than 100.4, they're calling that a temperature.
Temperature, okay.
Yeah,
all
so
right.
if you can get your temperature taken, and if it's over that, be calling somebody.
Okay, absolutely. I think mine was, it had gotten over that level. And then you said all of a sudden, you know, because I can remember, but you know, when I was getting ready to go to council meeting that night, and next thing I know, I was like chills, aches, and everything. I'm like, I'm not feeling well. Got home, got into bed. So whenever that happens, people need to be getting themselves to
Be thinking the flu.
be thinking the flu. Okay. Now I want to go back and talk a little bit about the H1N1 and the H3, because we're leading to my next point. I'm talking about I had the flu. I had never taken the flu shot before. Talk about the importance of people getting the flu shot, Bonnie.
What's in the flu shot is broken up pieces of the virus. And when you get the flu shot, it helps your body develop antibodies. So when you get the actual virus, it says, I've seen this before, I'm going to defend the body. So it's real important to get that flu shot. Well, there are 2 different flu shots out there now. We've got one that has 3 different viruses and one that's got 4. Both have H1N1, but the one that has 4 has an extra B virus. We have A flu viruses and we have B flu viruses. It's just the way that they're made up. And so we're seeing a lot of people getting their flu shot this year.
I imagine so. Now let me ask, is there a population of our community that should be, I guess, more so getting the flu shot than the other, or is it across the board?
It's across the board. CDC recommends that everyone over the age of 6 months get a flu shot. Now your children, what they'll get is a nasal spray up their nose up to a certain age. But everybody else can get that actual shot.
Okay. Now, and you know how the commercials come out. You said the infants can get the nasal up the nose. Are there any nose sprays for adults as well?
No, I believe the cutoff point is 50 years old.
50. Okay.
It might be a little bit younger,
Okay.
but I didn't check that one. But no, after a certain age, you have to have the shot.
Have to have the shot. Okay. All right. And the shot is, I guess, because I hear people going back. Is it for year to year? You do have to get it each
That's
year?
correct, because you don't know what is coming through, what's going to be passed around the next season. CDC and the World Health Organization monitors that very closely, so they know to tell the pharmacist what kind of vaccine to make.
Okay.
And it can vary.
Okay. And I want to ask you a question, because we're talking about H1N1 and then the H3. Have we seen over the course of time that the flu virus has gotten more aggressive, or what has changed? I would ask the question.
No, it's not gotten more aggressive. Remember back in 1918, we had a mass flu epidemic. A lot of people died. It was really bad then. What's gotten better is we've got the vaccine, so not as many people are dying. But we're aware that flu is out there. We have Tamiflu on the commercial talking about monitor your symptoms, call your doctor. So we're far more aware. Testing can be done very easily in a doctor's office or ER. Okay. And so people are wanting to get tested more. So I think it's just a recognition of what's going out there and people trying to take care of themselves.
Absolutely.
They're more knowledgeable.
Absolutely. I know after me being down for 3 weeks, I'm like, I got to do what I got to do now. Let me ask you now, Bunny, because we talked about, you know, somewhat the symptoms, the suddenness and, you know, the aches and feeling like you've been hit by a truck. What are some of the things, other than going to the doctors and making sure that we get the various testing done, what are some other things common things that we can do for ourselves? And I heard you saying exercising too. What are some other things that we can do?
Well, the first thing you do, of course, is stay healthy. And if you're a healthy person, you're going to fight this off pretty well.
Okay.
But when you get it, be sure that you drink lots of fluids, that you try to take some kind of nutrition. If you're in an area where your mom, dad, brother, sister, in an environment with other people, be sure everybody's washing their hands. If you go out somewhere, be sure you're washing your hands.
Okay. So just those common sense things.
Common sense things.
Okay, all right. And a lot of times, you know, you mentioned about, you know, the coughs and then perhaps the fever, to kind of stay away from or isolate yourself and stuff of that nature. And I think that is probably one of the better things, because as I was telling you before we came on air, I was at a conference and there was a gentleman there who was kind of coughing, and I kept looking at him kind of strange, wondering, are you okay? And I found out a day or so later that he wasn't okay, because I think 4 of us ultimately ended up getting sick there. Any other things that we can do other than getting the shot, taking real good care of ourselves, or just making sure that you know, we don't have those symptoms when they come on, is just to get to the doctor as soon as possible? If a person doesn't have a regular physician, is it important that they have one now?
Yeah, it's always important to have a primary care physician.
Okay.
Everyone needs to have one for situations just as this. Go in, talk to the doc, say, I'm fine, but I just need a doctor, and get that all set up before you absolutely need one, because it's going to be hard to go find one.
Absolutely.
When you come to crisis.
Okay. And as far as the cases here in Troup County, and I know that unfortunately, I think you were telling me, I think there were 7 deaths here. Do we still see people coming in on a kind of a frequent basis with the symptoms now, or do we see it sort of tapering off now?
It has tapered off over the last couple weeks. We've seen less flu in the ER. So maybe we're on the downside, but traditionally February is usually a high month for the flu. But that's traditionally, you know, we can always break tradition. So we'll see. Time will tell. Okay,
all right. And let me, just one last question as we get ready to close out. The death or age range of those that expired from it, was there any particular age range, or was it kind of a span of age range?
We've seen a span of age range, but it seems to be hitting those that are early middle age to middle age. When we had H1N1 the first time, we didn't see it in the elderly much, but we're seeing it more this time. But nobody can escape. We have a gamut. Have a gamut. Yeah.
So we just have to do all that we can to prevent and to take
prevent, and then get treated as soon as you can.
Absolutely. Well, Bonnie, I want to thank you very much for coming on and sharing this information. And by all means, our listening audience, hopefully they will take the heed what you've said, get your primary physician. If you feel those aches and pains, get your doctor, you know, plenty of fluids, rest, things of that nature. Most important, stay away from the general population, I think. Yes. Bonnie, thank you very much for coming on the show today.
Thank you.
All right. Ladies and gentlemen, stay tuned. We'll be back with more City Week in just a moment.
Why United Way? Because in some way, everyone in our community is touched by your donation to United Way of West Georgia. Yes, everyone. United Way helps 25 local agencies touch thousands of lives, even yours. To cause so many good things to happen, these organizations must have volunteers. Fortunately, more than 2,300 local volunteers are now giving time to the 25 local organizations that United Way of West Georgia helps support. Yes, more than 2,300 volunteers. But more are needed. Yes. Please volunteer your time, as well as your financial support. You'll be astonished at what you'll receive in return.
Welcome back, City Week, ladies and gentlemen. As we kick off the new year, there's some renewals and licenses and things of that nature that have to be renewed. And today I have on from the building office, I have my building official, Mr. Bill Newman, and also one of our license coordinator, Christine Reeves. Both of you are welcome to the show.
Thanks you. Thank you.
Well, it's a new year, Mr. Bill. We're hoping that this year we can sell a lot of housing permits and some other various permits. But talk a little bit about your role there as the building official, sir.
Well, our department, of course, issues all the building permits for all types of construction, for building, electrical, plumbing, heating, and air. And all of these licenses are issued now only to licensed contractors. There are some exceptions to that. If you're a homeowner and you're planning to do some work in your house and do it yourself, there is what has been defined by the state of Georgia as a repair rule, which is an amendment to those requirements for licenses, so that rather than having to hire a contractor to replace a door or cut a door in a wall at your house, you can do it yourself. But you still need to get the permit and have it inspected. That's the way the state looks at it. But we handle all of the permitting for building construction and additions, modifications to anything, and we also, of course, enforce all the city ordinances there that have to do with structural changes and condemning buildings, unsafe housing, and then we get into Christine's line of work, which is licensing of all of the regulated businesses such as alcohol and taxi cab services and that kind of thing.
Okay, all right, well, very good. And a number of things that the office is responsible for, and I'm going to come back to a couple of things that you mentioned in just a moment, but I want to ask Christine, because we are in the beginning of the year, and it's a busy time of the year for you and the other ladies down there in the office with renewals. Talk a little bit about your role there, Christine.
Okay. I handle all the new businesses and the renewal of business license. So this is the time of year that we have to renew your business license if you have a current business. If you have a new business, you come in and have an application that you complete, and it's also on our website that you can use. Also this year we have our renewals on our website, which is a little bit easier, and they can download those and fill those out and either email and fax or come in and bring them in.
Okay.
And renew those. So.
And you know, and every year, sometimes I come down and the line is out the door. You get ladies have stacks of renewal forms, and so we're very happy that people get them in. And we'll talk a little bit about those that may wait till after the fact. We'll try to get them in. We'll talk about what happens there in that case too.
Okay.
Mr. Beal, we'll go back to you talking about, you know, if someone is doing just maybe some fix-it-up around their homes, but they still have to come in and get a permit. What is the cost for that, roughly? It doesn't have to be exact.
Just about all of the building permits for a building permit itself is based on the valuation of the project.
Okay.
And there's a scale that we use, a chart, to determine how much that permit costs. Some of the electrical, heating and air, and plumbing work is set by number of fixtures and flat rates and that kind of thing. A lot of this stuff is going to be changed sometime in the next year or two. I think that we're working on, we do plan reviews, and plan review charges will probably coming up in the future, as well as modernizing some of the building permit fees that we have been charging for many years. I know that there haven't been any major modifications in building permits in 10 years now. So some of the stuff we're getting a little behind other cities on as far as rates go, but we try not to get behind any. We try to lead everybody in the way we do things and get work done, and try not to delay contractors and cooperate with them as best we can, with the idea that we're still going to hold them to the codes, and they've got to get their licenses in by the 1st of January. Okay,
all right. And you said, you know, a couple of things there that I wanted to expound on. You know, even if they're doing those little minimal things inside the home, it's still important to get that permit. And because if they don't, you can go out and put a stop work order on, and that would stop the progress and the work that's being done there.
Yes, that's correct. That's not something we like to do, but it is a recourse for us as a building official and as established in the state laws and building codes. Our department, if people don't get a building permit, we can put a stop work order on them until they get one. And violation of that stop work order usually results in a summons to go to municipal court, and let the judge explain it to them if they don't want to cooperate with us. We'd have it had very many of those. Most people cooperate well. A lot of times it's just a simple, I didn't know I had to get a permit for it. But we have a lot of calls of people, do I have to get a permit for this? And we always welcome those calls, because that means people are being proactive and not waiting until an inspector has to catch them without a permit.
Absolutely. And we're very happy for our general public doing that too.
Yes.
Let me ask Christine, when we're talking about the renewals of forms, and you talk, they're online, they can go there. When, say for example, a mom and pop store, what are the forms that they need to complete to make sure that they're in compliance?
Okay, there's an application that you start with, the basic application, location, and you know, who's all involved, manager and all that. You are required to get a fire safety inspection, and I need a copy of the lease if you're not the property owner.
Okay.
You know, so those are the things. And then there's other forms, federal forms, that we need to have completed.
All right. So the general cost for that mom and pop store would be?
It's 110. I mean, that's our flat fee for any business that comes in. It's not just that. I mean, you can have a big factory or a big corporation. It's still going to be 110. The cost may go up if because there is an employee tax. And that depends on how many employees that you have during the year.
Okay, all right. And I know that one of the things that we've changed on the forms this year is that our E-Verify number. Talk about the importance of that, and if someone didn't have one, how they can access that.
Okay. E-Verifying is something that the U.S. Citizen and Immigration Services set up. It's been going on for several years now. And as far as our requirements, the city, we ask that if you fill out or renew an application for business, if you have, there's 2 forms that you can pick from. If you have 10 or more, or 11 or more employees, then you are required by Homeland Security to E-Verify. And you can go on their website, E-Verify, or USCIS.gov/E-Verifying, and you can find out. It's fairly simple process to learn to see if you qualify or you're required to get that E-Verify number. And we are required to have it to issue you a business license or renew your business license. So we can hold it up if you're trying to renew and you don't have it. We have to hold your renewal forms until you get that license. If you have less than 10 employees, there's a form that fills out that you have to complete. And both of these forms are on our website. And you can choose which one. Do you have 11 or more, or do you have 10 or less? And you sign those. And those have to be notarized. So we do need to have those notarized. Both Miss Alicia in the office and I are both notaries. So as long as you bring your driver's license in and any other form because there is another form called a SAVE form that asks if you're a United States citizen or not. And if you mail in, fax, or email your renewals in, we do have to have a copy of your driver's license attached to the applications and renewal forms.
Okay, all right. So it's very important that the general public make sure that they are aware that there's some changes that have come down, because we have to report that to the Department of Revenue.
We sure do.
We don't, and we don't want to have to hold up anybody's license. Let's just talk a little bit about, because at the beginning of the year, all businesses should have their occupation renewed, and both you all can comment on this, Mr. Bill and Christine. What are the penalties for them not getting that information into us on a timely manner?
Well, we have given everyone a grace period. They're due January 1st, and your license do say they expire December 31st of whichever year is appropriate. But we do give you a grace period until March 31st, which I think comes on a Friday. So. On a weekend, but just make sure you get it in before then. And then interest start applying if you're late. You got a 10% plus 1.5% that'll start accumulating for every month that you're late. So, costs are high enough to run a business, so we feel like we've given you plenty enough time to get those renewals in. If you have any problems, we're easy to work with. Just contact us, at City Hall, and we can work with you on those forms.
All right. Mr. Bill, you want to add? Because I think sometime we may have to pay a visit to businesses as well.
Yes, every year we have, in round numbers, probably 70 or 80 people businesses that are a little slow on renewals, not always the same businesses. It just, based on how many businesses we have in LaGrange, it comes out to about that percentage of them that are late. And of course, what we want to do is try to impress upon people that January the 1st is a deadline, just like April the 15th is for paying federal taxes.
That's right.
You don't wait until April the 10th to start worrying about how you're going to pay your taxes 5 days from now. And we would like for people, if they can, to sort of start in November and December, start paying these. They got to pay them anyway.
That's right.
And go ahead and renew their business licenses, pay the occupational tax, and get it over with, so that we don't have this influx of special mail delivery with baskets of letters coming in on January the 2nd and 3rd and 5th, and then we have to go out and visit these people, the ones that still haven't renewed, and we go out and visit them and tell them that they're actually operating a business without a license since January the 1st. So they're cooperative. We don't have much trouble with them, but they just need some people need a little prodding, and that's what we're trying to get them in the habit of starting a little early every year. Okay,
well, very good. Christine, as we close out, if someone viewing and might have a question, give them the website and a contact number if you don't mind.
Well, just go to the City of LaGrange, our website, go to departments and then community development, and right beside the drop down to community development, there's a renewal form. The forms are on the line that you can download. There is a little question and answer section on there if you have any questions that maybe they can give you the federal or state location where to go on the internet. Okay. We do have, if you need to call us, we do have a location where you can go in, or I can tell you how to find your E-Verify number if you've registered, which is really simple. So I have that information if you want to give me a call at 706-883-2054.
Okay. Well, I want to thank both of you all for coming on the show this day and talking about this information, because it's very important that our businesses realize that they are now due their occupational to be able to operate in our city without penalties. And we definitely, we don't mind them paying the penalty, but we'd much rather them to get them in on time. So thank you, Mr. Bill. Thank you, Christine, for coming on the show today. All right. Ladies and gentlemen, stay tuned. We're back for more City Week in just a moment.
Why United Way? Because United Way of West Georgia helps support 25 local organizations. Organizations that make life better for all of us. Yes, 25. There's no easier way to help so many of your neighbors through a single donation. When you give to United Way of West Georgia, you help a lot.
Ladies and gentlemen, thank you for joining for City Week this week. My guests have been from the West Georgia Health. I had the Infection Control Manager, Bonnie Norwick, as she talked about the recent outbreak of the flu symptoms and also, unfortunately, some death that has been a result of the flu. So ladies and gentlemen, by all means, if you have flu-like symptoms, get to your primary physician and get it checked out. Also, I had on from the City of LaGrange, my building official, Bill Newman, and also licensed coordinator, Christine Reed, as they talked about the importance of getting your occupationals paid and in on time so that you're not penalized. Ladies and gentlemen, if you need more information, she gave you contact information and also the website where you can go and fill out those forms and send them in. Ladies and gentlemen, I hope that you've enjoyed those interviews. And as always, I want to invite you back for more of City Week.
Troup County Schools. A place where you can learn and grow.
A place where teachers care.
A place where family and school come together.
A place where learning matters.
A place preparing students for a bright future.
Whether going to college
or into the workforce.
Troup County Schools, preparing students for success.